So I'm here at Tealium Digital Velocity with Nirmal Vemmana. Nirmal, you want to tell me a little bit about your role with Tealium and some of the exciting announcements that Tealium has made here at Digital Velocity?
Nirmal Vemmana, product lead for healthcare and life sciences at Tealium. I've been with Tealium for 2 years now. I came on board to help grow our Tealium for Pharma product, and now I'm in the process of launching. Actually, I just launched our Tealium for Healthcare product. Before joining Tealium, I was in the industry. I was consulting for GSK, Pfizer, IQVIA, and then I worked at Merck in the R&D division for 2 years, right before joining Tealium. Yes, so very much a person of the industry with deep experience and, may I say, expertise in the life sciences world and the healthcare world.
At Digital Velocity, Tealium announced Tealium for Healthcare.
Mm-hmm.
Tell me a little bit about that. Tell me about the evolution of Tealium for Healthcare and the unique value proposition maybe that Tealium and Wheelhouse can bring to healthcare and life science clients.
Absolutely. So Tealium, we have been working in the heavily regulated space since about, I would say even from the beginning. So healthcare happened around 2013. So we've been HIPAA certified as a platform since around that time.
Right.
But as you know, starting out, HIPAA was rather simple. Even any major changes that happened over the years, they weren't that drastic. And then around the 2022 timeframe, the OCR bulletin, the earth-shattering announcement from the Office of Civil Rights came out.
Right.
So that sort of, led us into even deeper HIPAA compliance waters. And our partnership with Wheelhouse, so again, gave us a front seat into the issues our customers, our joint customers, and even our own healthcare customers were facing.
Yeah.
So we figured it would be strategic to build a solution that would offer the healthcare customer a HIPAA-regulated entity or covered entity, end-to-end control of the patient data that they collect, manage, and disseminate to support their operations.
Right.
So that's how Tealium for Healthcare came to be. So yeah, we announced it yesterday. I think the idea is it has to have two components. HIPAA compliance is really step one, but you have to treat that as a foundation upon which to build personalized engagement, like have that customer-centric communication and engagement strategy to really help patients and improve health outcomes. So HIPAA compliance is really the step one in doing that, because without compliance, without privacy being respected, there is no personalization that is compliant.
Right.
So we relied on Wheelhouse and, your thought leadership. There was a lot of conversations we had. And, for example, the 2024 March revised guidance came out from the OCR. Then that got conversations going as well. Hey, here's what I'm thinking. Are you seeing what I'm seeing as well? So I think Wheelhouse has been a great partner, collaborator in our strategy to, go to market with Tealium for Healthcare. We had to talk to a lot of customers. We did our own research. We spoke to our compliance professionals, and here we are. I think we have a great solution, and we're looking to collaborate with Wheelhouse more and more and help more and more customers.
Can you describe the solution for healthcare?
So yeah, it's really, how shall I put it? It's about gaining control over client-side data collection, controlling who gets the data from a activation standpoint. So everything, trying to move things to the server side where possible, and being able to control which client-side technologies are capturing data, if any, right? So it should be sort of a whitelisting, blacklisting approach, if you will.
Yeah.
If a particular vendor is not signing a BAA, they're not compliant.
Sure.
So they shouldn't be getting data from the client side. That would put our customer at risk. Obviously, they would be at risk of non-compliance. So only a BAA signing vendor should be able to capture data from the client side, if at all. Right. Again, that doesn't have to happen. If a customer doesn't feel comfortable firing somebody collecting data from the client side, they can move everything server side. We're giving that flexibility to them.
Yeah.
So again, giving secure data transmission capabilities to make sure, for example, PHI shouldn't be going to a non-BAA vendor, and that's the reason for preventing client-side data capture in the first place by these vendors. So again, having fine-grained control over what PHI, if any, is being shared with the trusted BAA vendors.
Well, so as you said, we've worked with Tealium for years. I think we've been engaged since around 2015. and have worked in concert to implement Telium for a number of healthcare clients. I can just briefly, for the edification of folks who might be listening or watching, describe the value that we've seen in working with Telium in a healthcare context and the way that we implement Telium. So we take control. We provide absolute control at the moment of collection with a private ID. And we govern the data that's collected with a data library that we develop in tandem with the compliance and marketing teams at our healthcare clients. And then we very much leverage Telium's event stream, that event data framework, because you offer a HIPAA compliant data hub.
Right.
And you sign BAAs with your clients, as do we. And so we can use collectively that data hub to cleanse URLs of sensitive information and offer injection blocking to ensure there's no third-party analytics payloads, and then leverage Telium connectors to offer that fine-grained control down to a single data attribute level to any third parties that might not be under BAA, or to route full fidelity data to an internal data store, a first-party data store as well. And Telium for a long time has been unique in the marketplace in that you have offered a HIPAA-compliant data hub, and this really expands that capability and formalizes it as an offering.
Correct. We're trying to productize as much of that as possible. That way, it's easier for our customers to use the tool. It's an easier value proposition.
Right.
It makes it easier for us to bring it to the market, again, to help our customers with the solution.
Yeah.
As much as possible.
It very much clarifies messaging and value prop for healthcare and life sciences. Yeah. And I know healthcare clients have been a big part of the attendee base here at Digital Velocity. I think 30 or 40% of...
Sounds about right, yeah.
Yeah. So a really good showing and a good reception as well. Can you share a little bit about what's on the roadmap for healthcare and life sciences clients with regard to Telium?
Sure. So I guess, as I said earlier, once HIPAA compliance is that first piece of the puzzle.
Yeah.
And then comes personalization. Now that you have that foundation, what can you do with it? You have clean, consented data from the patient or the member. Then how do you use that data to curate a personalized experience to our audience, to our customers' audiences? So to that effect, we're exploring, and we already have certain integrations on the pipeline. On our current marketplace. We have an integration with, we're exploring an integration with Wheelhouse Sonar and Wheelhouse Compass.
Right.
We also have other vendors and partners we currently work with for call center analytics, for website analytics, for A/B testing, experimentation, things like that.
Yeah.
So these are technologies that our customers can use today and get immediate value out of.
Yeah.
And then, we're also exploring other new integrations, like, for example, with Epic systems, leading EHR platform in the industry. So it's in our best interest to, again, if we want to give our customers the ability to personalize how they're serving their customers, I think integration with Epic it's a no-brainer. So we're exploring that. And trying to see around the corner as to what other vendors our customers might find useful in engagement, in engaging their customers with. So we're also exploring, what could be done with AI. What could we do some sort of intelligent observability type use cases? We're talking, we thinking strategically about these use cases, but one step at a time. I think right now, top of mind problem for most customers is achieving HIPAA compliance. So, and then once you've done that, let's help them achieve that easily and quickly. And then let's let them get value. Let them attack some low-hanging fruit in terms of personalization.
Right.
Then comes AI and all the other cool stuff, enhanced observability.
You mentioned Compass and Sonar, which are both applications from Wheelhouse. And just to explain, Compass is a HIPAA-compliant data warehouse that we offer and use with our healthcare clients. And Sonar is an automated compliance monitoring application that we use, and both can be married with Telium to support those implementations, with Compass being the first-party data store and Sonar monitoring and also reporting on the instances in which PHI is cleansed, the way in which that combined solution is actually protecting a client. Can you tell me a little bit more? AI has been very much in the zeitgeist here at this conference, just as it is everywhere else. Can you tell me a little bit more about the way in which Telium is beginning to employ AI? And again, what's on the roadmap that you might be able to share?
Yeah, I would say in terms of AI for healthcare, it's a bit too premature. We're still, again, very pie in the sky type use cases.
Sure.
But we are, in general, trying to support our customers' AI efforts. We're working on a solution to that effect. It's all about, again, clean, consented, correlated data.
Yeah.
No AI engine can't do anything. It can't do anything without good data. So Telium is the perfect fit for that. We already have the data unification capabilities. We already have the consent capture and enforcement capabilities.
Right.
That would make it such a no-brainer as a data supplier to the best NBA and AI engines in the market today.
Yeah.
So that way we can activate the unified data from different channels, disparate channels, could be digital, physical, first-party data, third-party data, all of that, and put a consent wrapper around it, and then feed that into AI, whatever engine our customers are using, and then get the insights in return, and then activate those insights wherever the insights need to go.
Yeah.
So I guess I'm sure there would be applications for healthcare within this paradigm. But what we're exploring is, could we do more? For example, could there be intelligent PII identification or PHI identification? So that's something we're starting to explore, very early stage.
Yeah.
We'll see. Hopefully we crack the code.
Well, I know in healthcare in general, in any context that involves a HIPAA covered entity, Telium can offer a unique value because you can assist clients in activating and leveraging that full fidelity data that you can still maintain internally, but you can control the way that it's shared with third parties.
And the way it's captured as well.
Yes, absolutely. Which otherwise can be on the continuum from problematic to impossible.
Correct.
For healthcare clients.
Yes. So consent works both ways. We can only bring in or only should bring in what the patient or the visitor, every visitor is a potential patient, like we talked about during our session yesterday.
Yeah.
In the absence of clear guidance from OCR about who is a patient and who isn't, you have to assume everybody is a potential patient.
Right.
That means caution must be exercised in capturing consent and only bringing in what they're okay with being captured.
Yeah.
And only sharing out what they're okay with being shared out, because it's their data after all.
Yeah.
So I think we have to be careful with that. But obviously, Tealium is in a pretty good place to be able to do that. Again, it's all about the end-to-end control of data capture, management, and transfer.
What else do you want healthcare organizations, potential clients to know about Telium's offering for healthcare?
Right now, the problem everybody seems to be thinking about and hyper-focused on is compliance, which is very important. I'm speaking to prospects and customers that are not even compliant. They haven't thought about compliance, and that's a bad idea. Nonetheless, we acknowledge that that is a top-of-mind problem. However, that should simply be step one. Before you know it, there would be need for personalization. There would be need to cater to the customer. Like the customers are bringing in sort of the online shopping mentality, as I like to keep calling it. They want that curated experience that takes their pain points into account. They want that specially curated journey, right, that takes their medical history into account, their preferences, how they want to be communicated with, what channel they want to be engaged on, things like that. Mm-hmm. So that is not a compliance problem. Compliance is part of that, but you need data orchestration capabilities to be able to do that. So don't just be happy with becoming HIPAA compliant. Use that as an opportunity. This is not a challenge, it's an opportunity that you can then use to think beyond. Otherwise, I feel like this is a great, I think healthcare organizations have almost been forced to adapt digitally.
Yeah.
A lot of them have, old tech stacks because they haven't had to. They have trusted vendors that they were using for many years. All of a sudden, these vendors are found to be not compliant. Even though they're free, they're easy to use, they're easy to configure. They are not going to help you in your compliance journey. So I understand the reluctance on why it took them so far, but the OCR guidance, the need to be HIPAA compliant in the way they have to be today, is forcing change upon them. So that is a great time to focus on an end-to-end customer experience. So think about data orchestration. Don't just be satisfied with compliance. Mm-hmm. Think about personalized engagement. Think about how can you serve your customer better without violating their privacy while taking their consent and their privacy into account, is what I would tell them.
Yeah.
So compliance and personalization, you should be thinking about both.
We were talking yesterday, and our experience certainly is that although there's the inevitable panic when people realize that they have to become compliant
Yes.
and they don't have access to all the third-party data that was so readily and freely available in other third-party platforms, it really forces thoughtfulness and refinement in marketing strategy, in audience identification, in performance monitoring and performance assessment as well. And our experience is that in that shift to first-party data-driven marketing strategies, although it's much harder at the beginning, you can drive outsized performance. We see very significant performance gains as we shift from third-party to first-party enabled marketing strategies.
It's one of your favorite topics, correct? Third-party data, the end of third-party data doesn't need to spell like doom and gloom.
Yeah.
Going back to using this as an opportunity, shift your mind a little bit, adopt a new mindset. Patients will trust you with their data if you prove the value to them, right? When you do it in a way that where they feel listened to, where they feel engaged, and if they trust you that you're with their data, if they trust you to not abuse the data, they would be more willing to share. And any insights that come from the patient is more valuable than some third-party data. This is your own. They're giving it to you. You should be using more of it, not less of it. You shouldn't have to feel shackled by not having access to third-party data sets.
What's also true is that third-party data is in control of those third parties.
Right.
And as a consequence, we're talking about HIPAA compliance for healthcare and life sciences, but the same sort of privacy regulations that now impact HIPAA-covered entities will impact, I think, all other industries in the very near future. And in fact, that's not even supposition. We know that Google is deprecating support for third-party cookies in Chrome. Safari and Firefox already do so. We know that Google then will implement what they've called a privacy sandbox. And so this data that is the lifeblood of most organizations from a marketing perspective is going to go away anyway. And the data to which you have access in the case of the privacy sandbox is going to be so attenuated that I think it loses value for organizations anyway. So the more you can take control of your own destiny now before you have to,
I think it's a win-win.
better.
It's a win-win.
Yeah.
I would say, I think regulations are coming for all of us. Healthcare is just the canary in the coal mine, I feel like.
Yeah.
And I'm talking to our pharma customers, and I lead both our healthcare and life science side. I lead the whole division from a product perspective. That means I'm seeing how things are changing in the pharma and the life sciences industry as well. As pharma organizations, even though traditionally they were not HIPAA-covered entities, in engaging the patients directly. For example, if they are to ship medication directly to the patient's home, and if they are curating an online experience to that where they can go, a patient can provide their insurance information and then ship the medication directly to their home address. And now our pharma companies, they're turning into online pharmacies almost. So that doesn't apply to the entire pharma organization, but certain divisions where they do direct to consumer engagement.
Right.
So they will now be regulated under HIPAA. I don't think that's a problem that is given enough attention by the pharma companies. I still keep getting asked, we don't need HIPAA compliance. Why should we buy? Why should we worry about it? It doesn't make any sense. We're not a provider organization. Oh, but the lines are getting very blurry. You are turning into a provider organization.
Yeah.
So it may not regulate your entire organization. The parent company will be fine, but your division, the direct-to-consumer division, could be impacted. So without having to, you shouldn't be worrying about whether or not you're a covered entity. You should be behaving as if you are and take the measures and put these safeguards in place, just like a traditional HIPAA-covered entity would.
Yeah.
That way, sometimes, it may not be a compliance issue. It could be a bad branding issue. You don't want to deliver an icky, less than desirable customer experience, even though you may not have, committed a HIPAA violation. That's bad for your brand image. But having the right controls in place, healthcare and life sciences both can benefit and thrive.
Yeah, I think it's also fair to say that we haven't been fined or sued yet is not a very good business strategy.
That's not it only takes one lawsuit. And the ticker is ticking. That HIPAA compliance fine.
That's right.
Ticker is always ticking.
Yeah. We have been implementing what became HIPAA compliant data solutions for a long time. In fact, we implemented our first in 2019, I think. And obviously, we've been working with Telium for a long time. You mentioned thought leadership. What has Wheelhouse done? What were we doing that has helped to inform Telium for healthcare?
I would say I think it has exposed that there was a bigger problem than we were paying attention to. It forced us to look at our competition and what they were doing. So we had to sort of adapt.
Yeah.
Great. Again, Telium is this, you can configure it to do anything basically, but that didn't quite cut it to serve our customers well. So that's hence the push for productization. But by collaborating with Wheelhouse, we knew the magnitude of the problem, right? Again, it forced us to look in places we wouldn't have looked.
Yeah.
It made us, we took a long, hard look at our competitors and understood what they were doing. And it revealed certain gaps, and that was the impetus toward building and launching Tealium for Healthcare. So I think I would say, Wheelhouse was a critical part in that. I mean, you have been great as collaborators, right? So whether it's thought leadership or, lending us a different perspective on how to think about compliance, you've been almost like a customer proxy, if you will, given your deep expertise and experience in the industry.
The initial OCR bulletin, the updated bulletin in March of 2024 has focused everyone on compliance. Ultimately, though, compliance limits the data to which you have access as a marketer. We've talked about the need to move beyond compliance and think longer term, think strategically about what you're actually trying to accomplish as a business and as a marketing team. What is unique about Telium's offering there?
So I would say compliance obviously has to be taken care of. But what's unique about Telium is the CDP and the HIPAA compliant data foundation will work seamlessly. So you can't tell where one ends and the other begins. So by the time the CDP kicks in, by the time you're starting to orchestrate data for that real-time personalized omni-channel experience, compliance has already been achieved. It's almost an afterthought. So it's that seamless integration of that personalization functionality along with the compliance foundation is something only Telium, as far as I can tell, is doing. A lot of vendors are focusing on either compliance or personalization.
Yeah.
But the vendors that are focusing on personalization, they can't serve this industry well because they haven't cracked the compliance problem. The vendors that are focused on compliance, they don't have the expertise and the experience that Telium brings to the industry to create those real-time personalization and real-time engagement across physical and digital channels.
Right. Thanks very much for chatting with me. I really enjoyed the conversation.
Likewise. Yeah. Always a pleasure.